Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Beth Boynton. She's a nurse consultant, and she's the author of the book, The Medical Improv Toolkit 10 Simple Activities to Promote Safe Care, Healthy Workplaces, and Rewarding Careers. There's an excerpt from that book on KevinMD. Transform your healthcare team with these 5-minute communication exercises. Beth, welcome back to the show.
Hi, Kevin. Thank you. Hi, everybody. It's nice to be back talking with you.
All right. So before talking about your excerpt, what led you to submit this particular one, Kevin MD?
Well, I knew that there was approximately 1,000-word framework to come up with something from this book that would give people a good idea about what it's about and why it's important. And so this excerpt is pretty much the entirety of a chapter 4, which is part of the first part of the book that goes into the how and why of medical improv. This chapter is about the vision. So it's preceded by, healthcare interactions are important. That's chapter 1. Changing behavior is hard. That's chapter 2. Medical improv is a teaching modality. And then this chapter, which is the vision of this book, which kind of encapsulates all of it without going into the actual 10 activities.
All right. So tell us about this excerpt for those who didn't get a chance to read it.
Yeah, well, I've been teaching soft skills as in healthcare as a nurse consultant for almost 2 decades, and I've been playing with, experimenting with integrating simple improv activities into those workshops,
Sure.
like workshops on speaking up and giving and receiving feedback, emotional intelligence. And what I've discovered over the years is what really works best is when you take the more traditional learning methods of a lecture and maybe a PowerPoint and a handout, and you integrate them with activities from improv because they're so experiential. And since the more I see how powerful these experiences are when I'm working with healthcare teams or students or faculty, it's like I want to be able to give other healthcare leaders the tools so they can teach them. You do need a little bit of understanding about improv and yes and, but you don't need to be an expert. And they're so powerful if healthcare leaders and managers can get a hold of a few, they can start to integrate them into meetings they already have,
Sure.
grand rounds. You can spend 5 minutes in grand rounds or human resources or a retreat. You can integrate them into just about anything else you're doing. And so then you're always building the skills and also maybe having a little bit of fun, which isn't a bad thing.
So give us an examples of some playful activities that could be integrated into busy clinical settings.
Sure. Well, so I would integrate them into the meeting. So, for instance, in one of the chapters, there's an activity called adjective name gesture. And to simply explain the activity, it's just in a circle. You go around and you say your name with some sort of an adjective that begins with the same letter and some sort of gesture. And then everybody mirrors it back. So I might say, I'm boisterous Beth. And then you and everybody else would have to mirror that back. So the way I integrate it in a case scenario is, which there are visionary case scenarios in each
Sure.
of the activities, rehab during a nursing clinic where they're at a rehab hospital.
Hmm.
So there's the rehab instructor, and what that instructor says is that what we're going to do is we're going to integrate these activities into our clinical experience, not with patients, but in our pre and post meetings.
Sure.
So they go around, they do that activity. He does it twice. And so then he starts to notice that the second time around that everybody is a little bit more vocal. They're a little bit more comfortable speaking up, which we know is critical in healthcare.
Sure.
And so then it goes on to how, so everybody's voice is heard in that situation. Then later on in the scenario, one of the students decides to work with one of her patients in the rehab unit, and he says he's Vivacious Vic, and Vivacious Vic raises his arm, and actually I bring it back to a clinical experience where the range of motion is actually improved. So that's something I made up. I don't want to present that as an evidence-based situation, but it's to give people an idea of how they can integrate the activity.
Do you find it challenging when you talk to these healthcare organizations to incorporate some of these improv based skills into their meetings or retreats?
hmm Yes, I think there's a lot of challenges around bringing this work into the field. And in this chapter, I talk about six of them. One of the challenges is that the activities require a little bit of emotional risk. We're
Yeah,
talking about changing behavior, and speaking up or listening can be challenging a little bit for everybody. So that's a challenge. Another stress is that to learn these skills in the clinical environment where there's like almost relentless nonstop pressure, what we can do by taking 5 or 10 minutes out of that clinical environment and removing the pressure to perform clinically, we can get a little bit more playful and a little bit more comfortable with taking the risk. Then once we take the risk, it's a little bit easier the next time. Another challenge is that to teaching these kinds of skills is that people are at different places.
yeah,
I might be more comfortable as a listener and good at that skill, but I might not be as confident about sharing ideas or concerns. Somebody else in an activity might be more comfortable speaking up, but not
yeah,
as good as listening. And so when we do an activity together with these activities, one of the elegant parts of it is that I get to practice my speaking up and developing my confidence while the person that I'm working with is actually practicing listening. And so we end up teaching each other. It's a really elegant design for developing the social kinds of skills that help us. And I think, like, a lot of the work in healthcare when we approach communication or other kinds of soft skills is that going to one workshop and then not going to another one for a year is not all that effective. It probably helps some depending on the
sure.
workshop, but we really need to practice them. And so if healthcare leaders get these simple activities and can get them going with their teams, they'll be creating social opportunities for those people to practice those skills. They go out into the clinical environment, they have an experience where they practice it, they get some feedback. For instance, in a typical yes and yes, but I think you and I have talked about this
Yeah,
before, I might gain an awareness at what it feels like when somebody yes buts me, or I might become aware that I am saying yes but a lot to people.
yeah,
So I get the awareness in the activity, and then I go out into my life and my work, and I find that, oh, I notice I say yes, but so then I reframe it and I get a different reaction. I get the feedback and it's a more open conversation. And so then I can integrate it more. Basically what I'm saying is like change of behavior is hard and we need a chance to
yeah.
practice it, and get feedback and try it again.
You,
So,
you
yeah.
mentioned earlier about some of these activities require some emotional risk, and some members of the staff may be more amenable to taking that risk than others. So how do you overcome that obstacle? How do you get people who are a little bit more hesitant to risk themselves emotionally to participate in these exercises?
That's a really important question, and fundamental in this book are the facilitation tips for each of the activities, and some of which I've learned over time by practicing. Let's see if even in that activity, I've been in groups where I can see visual that somebody is really struggling to have a physical expression or say, because we're not used to doing that in healthcare.
Hmm.
And so I've learned to do it I have a lot of different experiences where
Yeah,
I've come up with tips where I do it differently. So I might say, depending on the group and my sense of who might be struggling or who might be more timid or who might be, maybe a little bit more dominating, say, and to learn how I might position myself in a circle, I might start by saying, all right, let's do one with just the adjective and just the name. Forget about
sure.
the physical gesture, things that make it easier. I can't, and I say this in the book, I can't take the risk away, but I can make it safe enough to take it. And I can help other healthcare leaders that want to champion this kind of work learn. And that's actually why makes the big difference between just doing a silly activity and facilitating it in a way that is as safe as possible for everybody.
Tell us a successful case study or story where an organization implemented some of your techniques and really moved the needle to appreciable outcomes. So tell us a successful case study.
Well, that is a challenging question, and I'm going to answer it the best way that I can by just sharing an experience that I just had I was presenting to nursing faculty and students and theater faculty and students at SUNY Corning. And one of the senior leaders in this workshop thought, wow, this would be a really great experience. It was radical acceptance, and that's the one where people name something and everybody says yes to it, and then they
Yeah,
name something else. So you do it in the room, you can see just how visceral it can feel to people to be affirmed by others, and how this simple activity can help to create an opportunity for that. So her plan was to do it with nurse faculty. And
sure.
so we had breakfast the next morning, and she was, well, a little bit like, I'm not so sure, because now some of those apprehensions about doing something different can be. So I gave her a copy of the book, and I hope that she reads the facilitation tips. Sometimes it's like, as healthcare leaders, the first time you wrote a prescription, or anything that you did in your clinical world as a physician, was maybe a little bit scary. I know for me, the first time I gave an injection, it was scary, but I did it,
Yeah,
so getting that first time, do it, own that maybe this is, I maybe not in a clinical situation would I suggest this, but for this kind of teaching, I could say, this is the first time I've taught this, and it feels awkward. I hope you'll help me by
sure.
participating. And also, I think that taking the risk, shows people that you're human too. And then it gets easier, and you learn from the experience. And you also can have some empathy for the people that you're teaching that are like, don't want to do it. I had feedback, and this is actually answers your question in
Yeah,
terms of a success story, because I know I'm kind of
yeah,
going around it. But a physician, a UK physician, Esther Waterhouse,
yeah.
and she's a palliative care physician, and she actually is director of an organization called Medical Improv Great Britain.
Sure.
Anyway, she and I had a conversation a couple of years ago about that exercise, radical acceptance. And she wrote to me later saying it did feel, I did it in the middle of a meeting, a long meeting with her peers, and it did feel risky, but the feedback was great. People liked it, they enjoyed
Sure.
being cheered, and they wanted to do it again. So it's almost like leap and the net will appear a little bit.
We're talking to Beth Boynton. She's a nurse consultant, author of the book, The Medical Improv Toolkit 10 Simple Activities to Promote Self Care, Healthy Workplaces, and Rewarding Careers. Beth, who is the audience for your book? Who is the ideal person that you want the book to help the most?
Anybody that is in a leadership position in healthcare who works with healthcare teams, interfaces with them. So that could be physicians, nurse leaders, any managers, a management team that got this book with a senior leader that said, let's try this out
Sure.
even like emerging leaders that have a
Sure.
particular interest in teaching soft skills or including soft skills in their team leadership will be able to find this resource helpful. In fact, the endorsements that I have come from some of nurse leaders,
Sure.
physician leaders. Mike Smith, who's a physician in Nebraska, he wrote the foreword. He also teaches improv. So there's interdisciplinary
Sure.
people. Yeah.
And we'll end off with some of your take home messages that you want to leave with the KevinMD audience.
Yeah, thank you, Kevin. The activities themselves, all 10 of them, are fairly simple intellectually, but they all have very powerful social and emotional learning opportunities in them. So in this book, if you understand and are willing to look at the facilitation tips that I talked about earlier, and so how to teach them, and the book also gives access to video clips so you can see what they look like. They're just 1 minute. Some are even less than that video clip. So basically, the activities are simple. The facilitation is really important, and the learning that can be experienced individually, team-wise, and organizationally in terms of behavior and culture can be transformative.
Beth, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you, Kevin. It's always nice to see you. Thanks, everybody.